Hi everyone, my name is Dr. Vignan. I'm a doctor working with MFine, and today I'm going to talk to you about hernias. So most people know or have some idea about what a hernia is, but I'm going to clarify a little bit more. And also many people are scared about hernias because they look like swellings outside and they can appear scary to some people. So we're going to discuss hernia symptoms, hernia causes, and finally what is the treatment available for people suffering with a hernia. So first of all, there are several types of hernias, but the most common types, or almost 80% of all hernias, are the inguinal hernias and the femoral hernias. Now these happen around the groin area, present with a swelling around the groin area. Sometimes there's also going to be a scrotal swelling. Most often they happen in males rather than females. Now another common type of hernia is incisional hernia. This is when a hernia happens over an incision or any type of scar. So the common one that where we see this is after a C-section or a cesarean section post-pregnancy. There is a weakness in the scarring of the or wherever the surgical scar is, because of which the internal abdominal contents will push out and a swelling is seen. So this is an incisional hernia. Now one more common type is epigastric hernia, which is just below the sternum or just above the stomach. So the reason that a hernia happens, like I said, is when the internal contents push out and there is a swelling that appears outwards. Now because of this, you'll have some hernia symptoms. So the most common symptom is a swelling. Now the swelling increases in size when you cough or you squat or anything to increase abdominal pressure. Now with this increased abdominal pressure with coughing or any such increased abdominal pressure, you may also notice some pain. Now along with this, some people also notice the swelling keeps increasing in size as they cough. When they lie down, the swelling reduces in size. Now in rare cases, in case the swelling is big and the hole or the opening or the weakness is quite big, the bowel can go through it, which is the large intestines and the small intestines. These enter inside the hernia. And in some cases, if it becomes small or if it becomes too tight, too much pressure in that area, it can strangulate the bowel, which can lead to pain or bowel obstruction. So this is a big complication, and in those cases, we operate or we remove that hernia and repair it as quickly as possible. So now coming to the diagnosis and the treatment of hernia. So we can diagnose a hernia by looking at it by clinical examination. But in case that is not enough or when we can't determine the extent, we then go for imaging. We can go for ultrasounds or CT scans or MRIs as required, but usually an ultrasound should suffice. Now coming to the treatment of a hernia is usually very simple. We open up the area that is affected, we strengthen, we repair the weakness in the muscles on the outside, and then we suture it back and then we put it back together. Now there are newer techniques that are used nowadays. One is laparoscopic technique, where we do keyhole surgery. So very small incisions are used instead of using big cuts over the area. Now the latest techniques are robotic techniques, in which a robot does the incisions. This makes the healing time lesser. It provides better results. So that's why you can go for robotic surgery. So I hope this has answered your questions about hernia. If you have more questions, please do reach out to us in the comments below, or you can reach out to us on the MFine app or on the MFine website. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.